Here are two USMLE-style questions focused on Rett syndrome. Question 1. A 2-year-old girl is brought to the clinic by her mother due to concern about developmental regression. The child had been developing normally until 18 months of age, but the mother reports that over the past few months, her daughter has lost the ability to speak, regressed in motor skills, and has begun repetitive hand movements, such as hand-wringing. Physical examination reveals ataxia, scoliosis, and seizures. Genetic testing reveals a de novo mutation in the MEP2 gene on the X chromosome. What is the most likely diagnosis? A. Rett syndrome, B. Angelman syndrome, C. Fragile X syndrome, D. Klinefelter syndrome, E. Turner syndrome. Answer: A. Rett syndrome. Explanation: Rett syndrome is a sporadic disorder most commonly seen in females caused by a de novo mutation in the MECP2 gene on the X chromosome. It is characterized by normal early development, followed by regression in motor, verbal, and cognitive abilities. Common features include ataxia, seizures, scoliosis, and stereotypic hand-wringing. It is embryonically lethal in males, which is why it primarily affects females. Question 2. A 7-year-old female presents with a history of normal early development, but has been showing signs of regression over the past year. Her mother reports that the child had been walking, speaking, and engaging with others normally until around 18 months of age. Over time, the child has developed seizures, scoliosis, and is frequently seen performing repetitive hand-wringing movements. The child also shows signs of motor and cognitive decline. Genetic testing reveals a de novo mutation in the MECP2 gene. Which of the following is true about this condition? A. It is usually fatal in males. B. It is inherited in an autosomal dominant pattern. C. It can present with hyperactivity and impulsive behaviors. D. It is characterized by progressive hearing loss in affected females. E. It is caused by mutations in the FMR1 gene. Answer: Odd A. It is usually fatal in males. Explanation: Rett syndrome is typically sporadic and caused by a de novo mutation in the MECP2 gene on the X chromosome. This condition is embryonically lethal in males, and it primarily affects females due to the presence of 2 X chromosomes. The condition is not inherited, but results from a spontaneous mutation. It is not characterized by hyperactivity or impulsivity, and does not typically present with progressive hearing loss in affected females. The FMR1 gene is associated with Fragile X syndrome, not Rett syndrome.